the David Hoffman Society for Medical History and the Palomar Health Foundation are proud to present Mr. Ted Kleider in the third of a series of oral histories on North County physicians and hospitals.
It's great to be here and to share with you some of the knowledge of the background of the hospital district and the hospitals and where it all started and why it all started. Back in the late 40s, the only health facilities in the Escondido Valley area was a small little business that was down on Broadway, which at that time was known as Lime Street, in downtown Escondido. And it was a converted egg and poultry ranch that was run by two ladies, Charlotta Baker Hintz and Elizabeth Martin. They were a nurse and a dietitian from Anaheim Sanitarium who came down and set up a little 13-bed hospital down there. And that's all that the area had before a group of community leaders decided they needed a new hospital. And they formed the Escondido Valley Hospital Association. Walter Ross was one of them, Charlie Weslow, who was car dealer at Quality, Homer Heller, obviously the Homer Heller Ford, Delmar Gray was a school superintendent, and two physicians, Dr. Grable and Dr. Linus Adams. They were some of the formation committee for the Escondido Valley Hospital Association. It was a nonprofit corporation, and they decided to raise funds for a new hospital. They had fundraising events, they had bake sales, they had dances, they had a parade, a large parade, and they had two Hollywood stars, a fellow by the name of Harry Carey and John Wayne, who lived in the area. They both had ranches in here. John Wayne had a home out in Valley Center. So they raised money. They raised $155,000 from the community. They had a $150,000 goal, and they exceeded it by $5,000. Land acquisition for a new hospital was interesting. There were 3 sites that they were considering. Interesting, when we built Pomerado, we had 5 sites, and the same with when we built the new hospital here in Escondido. We had 5 different sites that we looked at. But there was a site in Harmony Grove, and there was a site in downtown Escondido, and then there was the site on Grand Avenue where the facilities sit now on Hotel Hill. An old hotel was there that burned down, and it was owned by a couple by the name of Henderson. The Hendersons, after the hotel had burned down, had moved up to Berkeley. Well, the committee decided that they wanted to approach the Hendersons for the purchase of the property. There was a price of $14,033 on the property. This is interesting. So the Hellers, Homer and Helen, went up to Berkeley, talked to the Hendersons, and they were kind of hesitant on selling the property at that time. They weren't really sure. So the Hellers came back, and there was a little bit of gossip that, well, they were probably asking $20,000 for the property. So they waited, and they received a call from Henderson's to come back up and talk to them. So the Hellers went back up, and the Hendersons said they would sell the property to the association for $12,965. And it was a surprising figure, and they figured, my gosh, that was less than what they were willing to pay originally. And so they asked, well, fine, they buy it for that, but how did they arrive at that price? Well, these people they studied numbers and words and so on, and 12,965 in the alphabet come out to life, L-I-F-E. L is the 12th letter of the alphabet. I is the 9th letter of the alphabet. F is the 6th, and E is the 5th. And that's how they decided the price. And that was a secret, and it had to be held as a secret until they passed. And it was. So we found out about that quite later on. But it was an interesting thing, and in 1946 then, the Hill-Harris Act was passed. That was a federal law, and it was a combination of funding from the federal, the state, and private funds. One-third was funded by the federal government, one-third by the state, and one-third by any fundraising from a private nonprofit group. And so the Escondido Valley Hospital Association applied for that to build a new hospital here, and it went through the state and federal approvals and so on, and they received the approval to do that. Well, also in the meantime, another state law was passed. The Health and Safety Code of the state of California allowed for formation of rural hospital districts. And that also allowed for you to raise funds to support a hospital from a geographical area in the state. And there are actually still close to 70 hospital districts in the state of California, 4 in San Diego County. Our district, the Palomar Health District, Tri-City, Fallbrook, and Grossmont are all hospital districts in California that were formed over a period of time. Of course, the Palomar District is the oldest. It was formed and called the Northern San Diego County Hospital District, which is a real mouthful. We've gone through a number of changes of the names. We went from that to Palomar Pomerado Health District, to the Palomar Pomerado Health System, to Palomar Pomerado Health, and the more recent is Palomar Health. And so those are things that occurred over all of the years since the original hospital opened. The original hospital was dedicated as Palomar Memorial, as a tribute to those who served during World War II. The dedication was on February 12th, and the hospital opened on February 16th of 1950. It was according to the Times Advocate newspaper at that time, it was the most modern, well-equipped small hospital in the United States. It cost $488,000. It was 37 beds, and R.J. McLeod was the first administrator, of course. He was hired by the association to manage the building of the hospital, and he stayed on as the administrator. 35 employees, 20 nursing employees, and 15 support employees. Private room cost $13 a day. A 2-bedroom was $11 a day, and a ward was $9 a day for the daily service costs. There were 20 physicians on the first medical staff, headed by Dr. Grable, M.B. Grable. And so between 1953 then and 1970, there were multiple additions to the hospital. There was an addition in 1956. Bond issue was passed of $900,000 to build the Adams Wing, which was the 3-story wing that still exists behind the McLeod Tower. Then again in 1966, another bond issue was passed, $6.85 million bond issue. And that built the McLeod Tower, the 9-story tower, which still exists, plus a lot of expansion and of the existing 1-story and 3-story facility that was there. The bed count when it opened was 37. When the Adams Wing was built, it went up to as high as 113. Before the tower was built, it was 150 because of different wings added and remodeling going on. And then the McLeod Tower, when it opened with 7 of the 9 floors to 240 beds, and finishing off the top 2 floors to 306. Then in that was in 1973 that the upper floors were finished. At that time, we also were considering the building of a Pomerado in the southern area of the district. The growth in the Rancho Bernardo, Penasquitas, and Poway areas showed a need for hospital facilities in that area, and it was decided by the board at that time to build a facility in that area. Certificate of need was applied for. We went through all of the hoops that the state put us through to apply and build the hospital and get approval. There was no bond issue passed for that hospital, surprisingly. We built that with a reserve, with reserve funds, and also with a revenue bond issue that the board financed in a joint venture with the County of San Diego. And so the hospital had to be financed by revenue that it and the rest of the district generated to pay for that hospital. 17.5 million. It was a 130 bed hospital when it opened, 144,000 square feet, and the daily room rate, it was all single care rooms, $118 a day at that time. Incidentally, we do not have a daily room rate as such today because of the charges are almost all combined into daily care, and I couldn't quote you what it is today because it changes quite often, and but it's up there in the thousands. We originally planned to have one single medical staff at the two hospitals at Pomerado and Palomar, but the physicians had a different idea. They wanted two separate medical staffs. Like they say, what goes around comes around. It's kind of interesting because today we now have a medical staff bylaws are almost exactly the same at Palomar and at Pomerado, and they also have joint credentialing now. So the two facilities' medical staffs are very, very close to being one medical staff. And as far as the board is concerned, it's almost like dealing with one medical staff because everything is the same on both medical staffs as far as the process, as far as their hearing processes, as far as credentialing. So it's that was something that was worked out over the last couple of years by physicians on both Palomar and Pomerado to cooperate to do that, and it was a real milestone. The 80s and 90s saw outreach services expand, home health, hospice, surgery centers, the trauma program, two skilled nursing facilities, the community health education program's expansion, which you see in the newspapers today, a large number of education programs that the district provides. Then reimbursement, of course, managed care, and reared its ugly head. And so hospitals at that time were encouraging consolidation and mergers and affiliations with other facilities. And so Palomar at that time joined together with Scripps for an affiliation and a merger with Scripps Health. What happened basically is that after about a 2-year attempt at terms and due diligence on both parties, it was decided to withdraw from that proposed agreement and for the district to continue on its own independently. And that was for the best interests of the residents of the district. We felt that it was important to do that. An agreement was signed in Kaiser in 1997, to take care of their OB patients at the existing downtown facility. And that was an unusual arrangement for hospitals to do that, although other hospitals have some arrangements with Kaiser. They have their own hospital, but some hospitals, Scripps, I think, does some open heart surgery for them and so on. And so we signed that with them, and now that has morphed into a 20-year agreement with Kaiser to take care of all of their patients at all the facilities. Kaiser patients can be hospitalized both at the downtown facility, the new facility, or Pomerado. So it's a full-service agreement for 20 years. It was an alternative to Kaiser building a hospital up here in North County. They thought about it. They have a number of office facilities. They have a large facility in San Marcos where they had thought about building a hospital there. And, but our plans to build our new hospital sort of got involved with them over the discussion of whether we would join with them on a single hospital somewhere else other than where we built the new one. And so that's will go on now until I think 2020 is when the agreement could still be renewed, of course, but that's how long that agreement was signed for. The planning and from the activities from the year about 2000, you know, is pretty recent to people. The last 12 years, it's kind of hard to say that 12 years is recent, but most of the community knows the planning and the architectural planning and that for the new hospital, for the hospital of the future. Of course, you know, we've had that. We had Proposition BB to build it, where the community got behind the district with a 70% approval to build the new hospital and to pass that, the largest bond issue, healthcare bond issue in the history of the state of California. No one has ever passed a bond issue that large. We've had a growth of the foundation. The Palomar Health Foundation has grown tremendously during that period of time. The new Women's Center and POP building at Palomar Hospital that is an expansion down there. And then, of course, the new hospital now is open and operating. So that's a little bit of the background and the history. I'll be more than happy to take some questions. Are some interesting sidelines. We had a number of board members. We've had 56 members of the community that have served on the hospital board over that period of time. Interesting, 13 of them were members of the medical staff, were doctors. First doctor on the medical staff was Dr. John Reynolds. That was back in 1965, the election in 1964 when he was first elected to the board. It was right after I came to work here. And so since then we've had 13. We have still have one doctor on the board at the present time. Dr. Aaron Wicks is a member of the board. At one time we had 3 members of the medical staff on the board. But we've had 5 RNs serve on the board, 1 speech therapist, 2 physical therapists, 2 pharmacists, and 3 administrators. And those 3 administrators are still on the board, retired administrators, and 3 attorneys. And out of it all, for the ladies here, there have been 14 women served on the board in all of that period of time. And Kay Godfrey was the first woman served on the board. She was elected to the board in, I think, 1960. And so we currently have 1 member, woman on the board. We've had as many as 3 at one time. So that's a little history and some statistics about some of the things that occurred. Yes?
Is the intention to continue as a district hospital into the future? Any discussion on any current mergers at this point?
There have been talk, there's been talk throughout the years about whether the district form is a good form. It's been very successful for us. Obviously, we had the approval of the people of the area. Our district encompasses just a little over 800 square miles. We're the largest hospital district in the state. We obviously are the largest facility-driven hospital in the state, having 3 facilities now and 2 nursing homes. So there's no other district that is as large as us and takes care of as many people as we do. There are districts that have sold their hospital or leased their hospital to nonprofit corporations and proprietary corporations. There's a number of them that went with Sutter. There's some went with Catholic Healthcare West. You know, Grossmont District is operated by Sharp. Fallbrook Hospital District is operated by another proprietary organization. So there have been a lot of other districts. I think there are probably, out of the 70-some districts in the state, probably 25 or 28 of them are no longer operating hospitals. They may be operating ambulance services, or they might be operating some skilled nursing facilities. Other than that, they've leased their facilities to another organization. The district has stayed in as an organization, as a public organization, and they may just own the land or own the buildings, but they're not operating the hospitals. Mm-hmm. Our foray into that was the chance to merge and with Scripps. That didn't work out. We had two facilities, and at the time, it was right after I came on the board. When I came on the board, the deal was almost sealed. I came on December 16th, and it was supposed to finalize on December 31st. And we re-looked at the deal and decided that maybe we wanted to go back and talk to them some more. So we did, and we went back and had more discussions for over a 2-year period, sorting out some of the financial and governance and that kind of issues. And we still didn't have a complete agreement on our board, and so Scripps decided that maybe it was wise to back away, which they did. We also had interest shown in our district from Sharp. They were interested in merging with us also. We decided that at that time it wasn't the thing to do. We would have to give up too much of our control, which we felt belonged to the people. They paid for all these facilities. They formed the district. It's very unusual. We represent the people out there, and we're answerable to the people. I'm elected by the board, I'm elected to the board by the people. And so I have to stand for election every 4 years. I have to stand for approval. Trustees in nonprofit hospitals don't have that. They only have to satisfy the other members of the board. And so they're granted, they need the approval of their public for fundraising and that, but not for the management. They can pretty well manage those facilities as they please. Ours is a little different situation. And so I think it's worked out very well here. We've had good board members over those period of time. They've been responsive to the public. And and there's still a number of other districts around the state that are successfully operating that way. And so I don't see any reason to go to a nonprofit. As far as other affiliations are concerned, we have been talking to other organizations, not necessarily to be a part of them or a corporate entity of them and so on, but to have working affiliations with them. We've talked to the University of California, San Diego off and on. We've talked to Loma Linda University fairly recently about some kind of a working relationship up in the northern area because they have a facility up in Murrieta. We've talked to Mayo Clinic, believe it or not, because they're looking at a national kind of networking with different facilities, and they're very selective on who they work with. But we've had some meetings with them that could be promising, and so we're an up-and-coming organization. It used to be just a kind of a peaceful little North County organization that has turned into the 4th largest system in San Diego County.
Yeah, I'm really amazed at the amount of progress in all the sectors here in the Escondido North County area. And congratulations to you specifically and to your board for having shepherded what is sometimes a very difficult relationship, as Tri-City Hospital District has shown us over time. So I'm really amazed at your progress. Let me ask you that, based on that preliminary, if the feds are talking about accountable care organizations, and we have the Affordable Care Act.
Yes.
I sometimes get them mixed up, but, obviously size counts if you're gonna deal with the feds. What, is there any forward looking at how the district fits in the light of those two federal programs? Are any plans being made?
Well, we're not looking at the accountable care organization. We did look at it. We've had some studies done. Our CEO, Michael Covert, is quite active. He's in line to become, chairman of the California Hospital Association within the next couple of years. He knows the people with AHA. He works very closely with AHA, and Bob Hemker, our CFO, is involved nationwide in activities regarding the financing and that. So we're looking at all of the different opportunities. Bundle payments is one of another alternative other than the accountable care organization, and that looks like a positive way to go. But like I say, until it all goes into effect, we'll see how these things shake out. Interestingly enough, there's only 2 organizations that I know in San Diego that are looking at accountable care organizations, and that Sharp is looking at it, and now I understand Tri-City said they're looking at it. But Scripps has said no, they're not interested, and we've indicated the same. So I think it just depends on the organization and how they want to deal with it. Of course, the new affiliation with Arch Health Partners that we have now with the medical group and Palomar Health is a good move, and I think that primary care is going to be the answer throughout it. You hear them talk about it. There's bills in to expand the reach of physician's assistants, nurse practitioners, to give them more freedom and what they can do in order to expand the primary care base, because that's where the problem is. I mean, if you take a look at it, we're going to have a great shortage in the state of California of primary care if all of the plans of the Obamacare or affordable health care, or whatever you want to call it, goes into effect the way they have it planned. As much as we know about the way they have it planned, let's put it that way, because there's still things coming out that we don't know about it as it moves on. So it's an interesting time in healthcare.
And I haven't really gotten familiar with what this Arch Health Partners. What exactly is the relationship there?
Well, it's a joint venture between the physician group, and it started out with Center for Healthcare was the basic organization of it, and it started out with, I think, 41 or 42 physicians, and so it's a joint venture partnership between the medical group and Palomar Health, and so we're partners in that group. The physicians are running it, basically. I mean, it's physician-directed plan, but it's allowable for districts as an alternative to employing physicians. We cannot employ physicians in the state of California, the district hospital, and so that is the alternative that we have to other states where physicians are hired, like the university can, and with Kaiser. We can't do that. So to have some kind of a close affiliation with physicians, the foundation model, which is what Arch Health Partners is, under California law, it's the foundation model. That's the only thing that we can have. Arch has grown considerably. I think it's 43, and I think now there's as many as 80-some physicians involved in it. They've taken some specialist groups in, affiliated with them, orthopedic surgeons and cardiologists and so on. So it's growing, You know, I can only say it's going to be very difficult for an independent physician to exist anymore in the healthcare environment that we're going to have under the managed care, and if we get to a single payer system, it's going to be very difficult. So they're going to have to join up somewhere, somehow, with organizations, and this is a vehicle for them to do it. The others.
I was wondering if you have any particularly memorable stories about some of the physicians you worked with, or volunteers, or families, you know, all entertaining. I had heard something.
Well, there's some things that I can share, and some that I can't. You know, back in the early days, I started in hospitals as a young man. I keep telling people that I started when I was 11 years old, but that's not really true. There were things were altogether different then. We didn't have the regulations that we had then. We didn't have a lot of things. I remember when I came to work at Palomar, Rod McLeod was administrator, and he walked in the door one day, and he had a bottle of scotch in his hand, and he said, he handed it to me, he said, take this down to Surgery B Wing. And I said, what? He said, take it down to Surgery B Wing. He says, that's for Dr. Nichols' patients. And I said, okay. And I came back and I said, well, what do you mean for that? Well, he said, Dr. Nichols, he says, after he operates on some of the men, he said, he asked them, you know, if they like a drink, and they say, yeah, so he writes a prescription and tells the nurse to give him a scotch and water. And I said, really? He said, yeah, and he said, we can't charge for that. He said, if we charge for it, he said, we'd have to get a liquor license with the ABC. He said, so we just include it for Dr. B. But that was a new one for me that I had learned. He said, Gordy Nichols, if you're one of Gordy Nichols' patients, you could have a scotch and water after surgery. But yeah, there were a lot of things. We used to have, employee picnics. Actually, at Palomar, we had a district picnic. I mean, it was for medical staff and employees and their families, and it was held down at Felicity Park. And we worked for 2 weeks setting it up. We go out and buy the beer and the pop and the pop. That's a Midwestern term, by the way. Soda. And we had a local restaurant would cook flank steaks, barbecue flank steaks for them, and the dietary department would provide some food, and it was a big function for medical staff and employees at that time. But we only had about maybe 350 employees at that time. It's a little hard to have a picnic today with close to 4,000 employees. But we used to have a Christmas party, and the medical staff had their Christmas parties. And so there were a lot of social activities that went on with the employees and the physicians in the hospital. And we used to have some Christmas parties in the hospital in different departments, and those are some of the things I can't talk about because it was always good to go to the housekeeping and maintenance Christmas party because the Mexican ladies made great enchiladas and tacos, and there was always a few tequila shooters also. But those were the days that you could get away with that. That's right. Any other questions about the facilities or the?
Well, I probably shouldn't ask this question because I doubt that a district hospital would have had this problem. But there was a time when you had to have a certificate of need if you were going to put up a new hospital. Did that affect this area at all?
Yes, we had to go through a certificate of need. We had to go through a certificate of need to expand. And we went through certificate of need for Palomar, which was a very detailed certificate of need. And we had great support from the community. One of who later became a board member, Dr. David Littauer, was a retired administrator from Los Angeles that had moved to Rancho Bernardo. And he became involved in supporting the need of a hospital down in the Poway, Rancho Bernardo, Penasquitos area. And so he went up to Sacramento and testified for us, and went up and worked with the state. He got very involved with the approval and with the certificate of need. Now, he's a great guy to have. He was a physician, an administrator. He retired as the administrator of Cedars-Sinai in Los Angeles. He came out from St. Louis to take over Cedars-Sinai when they merged. When Cedars of Lebanon, which was the old movie hospital, and Mount Sinai, which was the older, more Jewish hospital in Los Angeles area, when they merged, they brought him in as the administrator, which he had a tough road to hoe. And he did a great job in pulling those two together. He was I believe he was internal medicine as a physician, but then he went into medical administration. He was the first recipient of the Gold Award of the American College of Hospital Administrators at that time. And that was an award that was given to outstanding administrators nationally. He received the first one. So he retired in Rancho Bernardo and eventually became a member of our board. Great guy, just great to have him on board, to have that kind of a background and experience.
Got time for one or two more questions before we hang it up.
Well, Helen Heller, I've read a lot about her, and her son and daughter came here. And they shared that Helen had volunteered about 40,000 hours, so I assume you knew her.
Knew Helen very well. She was a great lady. Helen was one of the founders of the hospital auxiliary. Of course, that was a women's auxiliary, and Helen started and ran the gift shop for all of those years. And being a businesswoman like she was, the gift shop always made money. And the auxiliary, through the gift shop, donated a lot of money to the hospital over those years. Each year they'd come to the board meeting and present a great check to the board on fundraisers that they had throughout the year. You talk about fundraisers. We had 3 follies that were put on at by the auxiliary. The auxiliary sponsored these. Hired Cargill from New York, which is a production company. They would bring out all the scripts for the show, all of the costumes for the show, and a director. And the director would arrive in town, and we would recruit players from the medical staff, from the administration, and from the nurses, and from the community. The Palomar College musical ensemble would play at the show. The director would pick out different people to be in skits, musical numbers, dance numbers, and it was about an hour and a half show production with costumes and that, and it's amazing the talent that exists in an organization. It is amazing. Georgie and I danced in 5 different numbers. But you know, we and I sang in a very famous trio with Dr. George Salzberg and Dave Willits, who was a retired colonel in Rancho Bernardo. And those 2 gentlemen and I were Georgie's girls. We were dressed in full formal costumes, wigs, and had our own song that we sang. And I was Martha Washington, and George Salzberg was Dolly Madison, or he was Betsy Ross, and Dolly Madison was Dave Willits. And we all had our singing parts, and we were Georgie's girls. So I mean, and there may be pictures. There are pictures of me around this area that could just as well be buried.
Did you ever meet your neighbor, Lawrence Welk? Because I know the Welks resort.
Yeah, I never met Lawrence Welk. He was active here in that time. I mean, and some of his people were in the hospital off and on, but never made any real contact with him. So I didn't know him that well.
His grandson just toured the new Palomar Medical Center.
Yeah, very good.
Ted, thank you very much. It's wonderful to hear all these stories about how this
Like I said,
great institute developed.
I could sit and talk about this for
I'm
3
sure you
hours.
could. Let's give him a hand.